our title, Improving Patient Experience Through Language Access, HCAHPS, by Habib, Cody, and Herman. So what is HCAHPS? The definition of that is, well, it's an acronym first, which is Hospital Consumer Assessment of Healthcare Providers and Systems. It's a standardized survey that is used to measure the experience in hospitals by patients and families. The survey uses different areas such as communication with nurses and doctors, hospital environment, and safety, and just overall satisfaction. I have an image to the right which shows that what it looks like, and then why HCAHPS matters. So it measures the quality from the patient and family perspective. Clinical outcomes are important. So having something to show how patients and families experience the care becomes essential. Identifies areas needed for improvement. Um, if there's low scores based on the surveys, they can show or indicate that there's something wrong with the communication, teamwork, or just the hospital environment. It supports patient-centered care. Hospitals sometimes fixate on things outside of patient experience. And then it provides accountability. So hospital leaders can track performance and ensure that certain departments meet quality standards. And then going back to performance, it could be a good way to allow for benchmarks. So being able to track performance and ensure that they're improving, as well as measuring their performance compared to other hospitals or just the national average. And then the focus area is language barriers. Communication is essential for safe, high quality care. Families with limited proficiency may experience barriers to understanding medical information. One way to combat this is having professional interpreters that will bridge that barrier. Communication barriers affect satisfaction, safety, and even health outcomes. We chose this specific topic because communication is a key component of healthcare quality. Analyzing language preference helps identify opportunities to improve communication, which we already established is essential. And then our research questions. So the first research question is, what is the distribution of preferred languages among families who participated in the survey? And then our second research question is, for families who prefer a language other than English, how often did they experience difficulty in getting help or obtaining information for their child? And then why this matters. This matters because it evaluates whether language barriers affect communication and access to care. This is important. There are families who do not speak English as their preferred language, which might present problems when it comes to access to care. Understanding the relation between quality of care and language allows Mercy Grace Children's Hospital to improve patient experience.
Here we have our first graph, which we're looking at the preferred language distribution. And from looking at the graph, we see that English is the most common preferred language, which is 40%. And then a majority of families, which is 60%, prefers a language other than English. And Spanish is the second most common language. And then several other languages are equally represented, which include Chinese, Vietnamese, Korean, and Russian. This graph also indicates a diverse patient population with varied language needs, and also shows that there's a potential language barrier that might impact communication and patient experience. Next, we have language barriers and patients experiencing challenge. Over 60% of families prefer a language other than English, and non-English speaking families may face difficulty understanding care and care instructions. There might be delays in communication, which can impact treatment and patient satisfaction. There's also an increased risk of misunderstandings between providers and families, and language barriers may reduce trust and overall hospital experience. Next, we have difficulty getting help or information, and this graph shows problem getting help information because of language barrier, and it shows the percent of patients dealing with the language barrier and with them struggling to get help. And the survey asks, because a provider could not easily talk with you in your preferred language, how often did you have a problem getting help or information you or your child needed? And this question is important because it shows whether language barriers are affecting families' ability to understand care plans, ask questions, and receive the support they need during their child's hospital stay. And some non-English speaking families reported difficulty getting help or information. Communication barriers can delay understanding of care plans and next steps, and these responses show an opportunity to improve interpreter access and provider communication. Here we have confusion about care due to language barriers. And the survey asks, during this hospital stay, because a provider could not easily talk with you in your preferred language, how often did you feel confused or unsure about your child's care? This question helps show whether language barriers created confusion or uncertainty for families during their child's hospital stay. Even if only some families reported confusion, this is important because understanding care plans, medications, and next steps is a major part of patient safety and family-centered care. Language barriers can make families feel confused or unsure about care decisions. Confusion may affect trust, discharge understanding, and follow-up care, and improving interpreter access can reduce uncertainty and improve the family experience. Here we have key findings from the HCA-HPS language access data. And our first finding is that language diversity is significant. Families reported multiple preferred languages, including English, Spanish, Chinese, Vietnamese, Korean, Russian, and others. This shows Mercy Grace Children's Hospital serves a diverse population with different communication needs. Our second finding was communication barriers affect access to help. Some families reported difficulty getting help or information when providers could not easily communicate in their preferred language. In this measure, never is the best response because it means families did not experience that problem. Our last finding was language barriers can create confusion. Some families also reported feeling confused or unsure about their child's care due to language barriers. This matters because confusion can affect trust, understanding of discharge, follow-up care, and patient safety. Overall, language access is a patient safety and quality improvement issue, not just a communication preference.
Next is our root cause analysis, which we used a fishbone diagram for. Looking at the root cause of the issue, we identified four main areas. First, interpreter access, where there may be limited availability or delays in connecting to interpreters. Second is the staff workflow, where interpreters use is not always built into the process, or staff may forget to ask about preferred languages. Third is training and awareness, where staff may not fully understand when interpreter services are needed, and families may not know they can request help. Lastly, system and processes issues, such as patient preferred languages not being clearly visible in the system. Overall, this shows that the problem is not just one issue, but a combination of gaps in processes, training, and system design. So next, recommendations and improvements. Based on the root cause, we developed several recommendations. First, improving interpreter access by making sure services are available quickly and consistently. Second, integrating interpreters use into standard workflows so it becomes a routine part of the care. Third, providing a staff training to increase awareness of language needs to use interpreters. And finally, improving system processes such as clearly documenting preferred languages in EHRs and creating an automatic reminder. These changes would help reduce communication barriers and improve the overall patient and family experience. So, measurement plan. To measure whether these improvements are working, the hospitals should continue tracking key survey responses. This includes interpreter access, problems getting help, or information and confusion about care. For some questions like difficulty getting help, never is actually the best response because it means no problems were experienced. Over time, we could expect to see increase in positive responses and a decrease in negative ones. The goal is to show measurable improvement in communication and patient experience. So, expected outcomes. If these improvements are implemented, we expect several positive outcomes. Families will better understand care plans and instructions, which would reduce confusion. Patient safety will improve because there's a lag. There's less risk of miscommunication. Satisfaction scores should increase as families feel more informed and involved. Finally, this supports equality by ensuring that non-English speaking families receive the same level of care and communication as everyone else. To conclude, language access plays a major role in providing safe and patient-centered care. Mercy Grace Children's Hospital serves a diverse population, and communication barriers can impact how families understand care. By improving interpreter access, workflows, and training, the hospital can reduce confusion and improve the overall experience. Clear communication helps families feel informed, respected, and more confident in their children's care. And here are our references. Thank you.